Every day that elective surgeries are left on hold is another excruciating day of waiting for those in need.
I'm in constant pain. And they said, right, you've got 6 months and we'll operate. And it's been 6 months. And they rung me up and said, oh, due to COVID, we've had to put your operation off. And I'm like, okay. That's, it's something that I have to keep dealing with until they decide they're going to do something about it.
A huge portion of the Territory's hospital resources have been diverted to help deal with COVID patients, leaving people like Ms James with no idea when they'll get the help they need. She was already waiting for elbow surgery. Now she's also on an emergency wait list for heart surgery.
Knowing how long I've had to wait for the other surgeries, it can be quite scary, because my heart could play up at any moment and I could either have a stroke or die, basically.
If the management of medical conditions are delayed and surgical conditions are delayed, that can often lead to very much more complicated and expensive issues down the track.
The pause on elective surgery is only meant to be in place while the Territory comes down off a peak in hospitalisations from the latest Omicron outbreak. But today's case numbers suggest that peak could still be weeks away. There are now 168 people in NT hospitals with COVID-19, including 3 in intensive care. 2 people with the virus have died in RDH in the past 2 days, both women in their 60s. There were almost 1,200 new cases reported today, including 37 cases being added to yesterday's tally. It means the 7-day rolling average is still above 1,000 cases a day. A peak hasn't been reached yet, and hospitalisations usually present up to a week after cases are detected. As more and more people with COVID-19 need care in NT hospitals, more and more of Royal Darwin Hospital is dedicated to people with the virus. It's an incredible level of extra pressure on an already strained system.
The Territory hospitals were the busiest in Australia, with health separation rates 2 to 3 times as busy as other states and territories, and that was before the current COVID issues.
The Australian Medical Association estimates the cost of easing the pressure would be $500 million, a price many would think is worth paying. Nicholas Hines, ABC News.